On August 8, 2018, my patient came in with a chief complaint of right upper back, right shoulder, and right arm pain. Ms. Gigi is a 70-year-old Caucasian female with a past medical history of anxiety and seasonal allergies. She came in as a new patient with her daughter complaining of this muscular pain that she rated as 8 out of 10 on a pain scale. She described the pain as dull and throbbing, but also experienced shooting sharp pain that would radiate from her right upper shoulder to her right arm. The patient also associated pain with numbness and tingling in her right hand. The patient said the pain was going on for a little over than a week, and she recalled moving heavy boxes as she was starting to return to her home, which was destroyed by Hurricane Harvey, but couldn't recall any other muscle injury to those areas. The patient had been taking over-the-counter ibuprofen and acetaminophen, as well as applying Biofreeze to these areas for relief, but wasn't feeling much better. This morning, the patient woke up, and while showering, she noticed a red rash on her right shoulder and some blisters. She popped these blisters and claimed that she thought this was an allergic reaction to the frequent Biofreeze use that she had been using. The patient denied any limited range of motion, both active and passive. She denied headache. She denied urinary incontinence. She denied any lack of muscle strength. The patient denied any previous spinal injury. Like I said earlier, no muscle injury as well. She also denied having a shingles vaccine in the past. The patient was not taking any current medications other than Zyrtec for her seasonal allergies. On physical exam, the patient's blood pressure was 140/88. Her heart rate was 68. The patient had a temperature of 98.9. Her respiratory rate was 16 breaths per minute. She had a BMI of 29.9. She was 5'4" feet tall and 170 pounds. Her pulse ox was 98% oxygen. She was alert and oriented ×3. She was well groomed, good posture, dressed, no apparent distress. On her skin exam, she had linear erythematous papules on her right upper shoulder and scattered blisters. Some were open and some were still in the blister form. They were all localized to the right shoulder. Her skin was tender to touch on the right neck, the right shoulder, and right arm. She had normal hair distribution. Her head was normocephalic, her face was symmetrical, her sclera were white, and her conjunctiva were pink. The patient wore glasses. I listened to her chest and her heart. She had regular rate and rhythm, no murmurs, rubs, or thrills. On her chest exam, she had clear lungs, no accessory muscle use, good chest expansion, no adventitious sounds. For her neuro exam, she has steady gait, her sensation was intact, and her strength was 5 out of 5. Her musculoskeletal exam showed good muscle bulk and tone, no limited range of motion, and she did have a negative valence test. I was testing for carpal tunnel. She experienced numbness and tingling paresthesias in her right hand. I had her hold this position for 90 seconds, and she denied any numbness or tingling. For my diagnosis, I diagnosed the patient with nerve pain due to shingles, ICD-10 code B02.9. I explained and educated the patient on the varicella-zoster virus, which causes shingles as a reinfection from the chickenpox virus. I explained the mechanism and pathology of the virus to the patient and also reassured her her concerns for transmitting the infection to her family, which she was currently living with, as well as her grandchildren. The patient also had elevated blood pressure, ICD-10 code R03.0. The patient did not have a history of hypertension, but on today's visit, she did have elevated blood pressure 140/88. The patient also had a past medical history of anxiety. We discussed her stress, and she reported significant stress with her recent move back into her home, the renovation, and just lots and lots of anxiety concerning those areas, which was definitely not healthy to her life right now. The ICD-10 code was F41.9. So for my plan, me and my doctor prescribed the patient valciclovir for shingles, which is an antiviral. The patient was given 30 pills and was told to take 3 1,000 milligram tablets a day for this viral therapy. We explained the action of the medication and explained that she can also take over-the-counter analgesics to help with the pain as well. We told her to stop the Biofreeze as when she was using it, she did have active lesions, and those could be spread through direct contact or even air. We also told her to no longer pop those lesions. For her elevated blood pressure, I advised her to maintain a low salt diet, and I also encouraged her to go ahead and buy a blood pressure cuff and monitor that twice a day and keep a log. For her anxiety, we discussed the patient's sources of stress and explored some options for her. She denied any desire for medication, but we did discuss some relaxation techniques, and I provided her handouts for some counseling resources. We decided to follow up with the patients in 7 days. At that point, we would readdress the shingles virus, see how she was doing with her pain, and she would be more than halfway through her medical treatment. We would also look at the blood pressure log at that point and see if, check her blood pressure that day, and see if there would be any need for a diagnosis of hypertension and medical therapy thereof. We would also address her anxiety at that point. We encourage rest, sleep, and just overall good morale to make sure this patient would get better in time. That was my patient, and thank you so much.